You have learned already the basics of research and nursing research. Now, let us see what could be the possibilities of a nurse in the field of nursing research. What could be his or her or your responsibility in conducting one? So, with this module, you are expected to integrate relevant principles of social, physical, natural, and health sciences to include humanities in conceptualizing nursing research, demonstrate continued competence and professional growth in nursing research, and recognize the roles, responsibilities, and competencies of a beginning nurse researcher. As a background for the beginning roles of nurse as a researcher, I would like to present to you the 2012 National Nursing Core Competency Standards. In front of you is the framework, but what would be the reason of the Board of Nursing and the administration to implement this National Nursing Core Competency Standards? It is heightened by the escalating complexity of globalization, dynamics of information and technology, demographic changes, healthcare reforms, and increasing demands for quality nursing care from, of course, our patients, the consumers. Expectations for contemporary nursing practice competencies have already or also emerged. Thus, in the year 2005, as an output of the key project of the Board of Nursing with the resolution of 112 series of 2005, they do promulgate the core competency standards of nursing practice in the Philippines. As mandated by the Board of Nursing, they ensured through a monitoring and evaluation scheme that the core competency standards are implemented and utilized effectively, not only in nursing education, but also in the development of test questions in the nurse licensure examination, and including also in the nursing service as a basis for orientation, training, and performance appraisal of those in the public and private healthcare facilities, including the community. So in front of us, you will see the framework. So the National Nursing Core Competency Standards is composed of three uh, beginning roles of a nurse. First would be the beginning nurse's role on client care, the beginning nurse's role on leadership and management, and of course, the beginning nurse's role on nursing research. I would not be discussing the two roles with the client roles and the role in the leadership and management. Let us focus on the beginning nurse's role in research. This is composed of three responsibilities. First is that nurses should engage in nursing or health related research with or under the supervision of an experienced nurse. You, as a nursing student, you will be starting to hone the skills in formulating, conducting, and evaluating researches with the help of your instructors in the college. Secondly, it you as a nurse should know how to evaluate research studies, including reports, utilizing guidelines in the conduct of a written research critic. So we are to evaluate and appraise the content, the result of the research outcomes, and should it be utilized or how can it be implemented in the clinical settings where we are working in. And the third responsibility is when the nurses applies the research process in improving client care in partnership with quality improvement, quality assurance, and nursing audit. Remember that the research also has a process known as your research process. So this process should be accomplished by the nurse when conducting a research study. And of course, after completion, The last phase, which is the dissemination, is when we now utilize the results of these researches, utilized for the need for increasing in the patient outcomes and, of course, management of our clinical nursing units. In terms of the first responsibility, which is engaging in nursing and other health science research, the nurse is expected to perform the following as indicators of how does the nurse comply with the first responsibility of doing the research. First is that the nurse should participate in preparing the research proposal, complying with the ethical principles of nursing research. So the ethical principles shall be discussed in the latter modules. So as an overview, it may include the implementation of a ethics not only as a client when you do client care, but also, of course, when doing research, such as doing non maleficence, implementing justice, and allowing patients autonomy. Secondly, a nurse should conduct a research study as a member or as a leader of a team. So it's either you can do it as the primary author or the primary investigator or a co-author or co-investigator of the research. You can do it solely or in collaboration with other members of the healthcare team. Remember that you can do not only nursing research within your team as nurses, but more so you can also collaborate with the multidisciplinary team, which is composed by maybe physician, nutritionist, dietitian, medical technologists, and other members that are working in your health facility. So multi-collaboration or multidisciplinary research collaboration is way better than those of a one-sided uh, health science research. Third is that you as a nurse should present the research study conducted in partnership with a team, prepares a written research report, and conducts an oral or either poster presentation. Of course, for the utilization of other health facilities that may be benefiting from the study that you have conducted. The second responsibility is again to evaluate research studies and, of course, to utilize it as part of the guidelines. So, components of this are first to determine if the research problems or question, objectives, and or hypotheses are clearly and logically linked to the research purpose, concepts and relationships, and or propositions generated from the study framework. And of course, analyze if the conceptual framework of the summary of review of related literature, research design, and data analysis procedure are logically linked to the purpose, problems, questions, and hypotheses. Take note that we, as we do the health science or nursing research, is that we should be utilizing concepts and theories related to nursing. Why is it that so? So we do it for us to enhance the science in nursing, meaning we increase the body of science that we do in nursing for the delivery of our nursing care. So we make sure that these are interrelated and connected to the purpose of the study. Further, we should establish the interpretation, implications, and recommendations which are consistent with the results considering the limitations of the study. Remember that part of the research study in the conceptual and the designing phase is to include related literatures, which may be related to the study that you are conducting or doing. So these literatures will help you uh, see or look for possible implications to future delivery of care or for the future implementation of nursing services. Then, you as a nurse researcher should analyze the research study report for adherence to standards of writing mechanics, ethical principles, and guidelines in all phases of the research study. And last of the responsibilities is that when you, as a nurse, apply the process of improving client care in partnership with a QI, QA, or other nursing audit team. So, as a member of the quality team in implementing the appropriate quality improvement process on identified improvement outcome, you should perform the other tasks or the following. You prepare the data collection and analysis plan as a member of the quality improvement, quality assurance, and nursing audit team. You may also conduct collection and analysis of data with the team members based on the agreed plan or the task that is assigned to each and every members of the team. And of course, implement with the team the developed action plan and identified variants to improve the system of or the processes. Okay, so remember that we have three responsibilities as a beginning nurse researcher. Now let us see what are the different roles of the nurse in terms of research. So we can act as a principal investigator or what you call as the team leader. For example, in your group, you would be assigning a team leader, okay, and that may act as the principal investigator. So as a member of a research team, so you're a co-author or a co-member of or co-investigator of the research team. You may act also as an evaluator of the research findings. However, the difference with the initial two roles is that you do participate as an evaluator at the latter part of the research study. You may act as a consumer of the research finding. For example, you are working a, working in a health facility and one of your coworkers conducted a research in your unit and they have found out that some of the nursing interventions could be enhanced through the use of training as a result of their research. So you may be receiving that training as a result of the findings of their research. And you will and with that you act as the user or the end user or consumer of the research finding. Next is that you may act as a client advocate in the research study. Of course, we have mentioned the application of ethics and legal aspects for the conduct of nursing research. As an advocate, you protect the client's right and uphold it when the client cannot decide or even protect himself. Okay? You ensure that other researchers secure a consent from your clients and that your clients may not be in peril when they do participate in research or it will not cause them any bad implications and outcomes. And lastly, you as a nurse may act also as a participant or subject of the research. So you may answer questionnaires, you may accept interviews based on to the expected participants of the research that is being conducted. Now, how can we say that a researcher is of a good or good with good quality characteristics? So, a good researcher is an honest and credible researcher, meaning you do not tamper information, you do not change the data so as to get an agreement with what you would like to see as a result of the research. Another is that there is an accuracy in the data collection. As I have mentioned, should be no changing or alteration in the data that you have received. If you see that the data that you have collected is not congruent to what you would like to get as a honest researcher, you will still uphold what is the result of the data. So that is what we meant by the accuracy of the information. As a good researcher, you are organized and systematic. Since it is a process, as we have mentioned, we should follow it step by step. We should uh, declutter. It is as if we are decluttering our tables or organizing our schedules. Of course, you as a nurse researcher should be logical. We use critical thinking in every step of performance or the performance of the nursing research. And you should be self-aware. You are imaginative and curious, seeking more possible solutions to the problems that you have posted. You do not look only onto the, for example, you are doing your review of related literatures, you do look not only onto the advantageous or the agreeing one's result, but also onto those with disagreement to the other researches. Okay? As a good nurse researcher, you are also persistent with barriers. No, you have to set limit in terms of respondent and researcher interaction, relationship, which should be maintained to be considered as professional good researcher. So you should also establish good relationship not only with the participants but also with your team member. So usually when we do research, the team member may be having difficult times or problems in the relationship because of the concerns with the task assignments. Especially you as nursing students, you may be experiencing lots of problems such as this. Make sure you have to resolve it and leave the drama at the door and complete the task that is being assigned to you. And of course, you as a nurse researcher should be updated and informed of the present issues and events pertaining to the phenomenon that you are studying. Now you have acknowledged what are the different responsibilities of the nurse when you graduate or you start working in the hospitals or healthcare facilities as a nurse researcher. Okay. Or even if you are employed as a staff nurse, you can do or perform clinical researches. Of course, you have also identified your possible good characteristics to be a nurse researcher. And now, when you are in the clinical area and you are very much enthusiastic or and inclined in doing research, will you think at times that really belong to some group or interest group in the nursing profession, which would like to do researches all along, okay, from the start of my career as a nurse. So I would like to present to you an organization which is accredited or recognized by the Philippine Nurses Association and by the Board of Nursing as Interest Nursing Group. Okay, this is PNRSI, or known also as the Philippine Nursing Research Society Incorporated. So let us explore who and what are they. The Philippine Nursing Research Society Incorporated is composed of nursing research experts and, of course, peer reviewers, both locally and internationally. And, of course, these are Filipino nurses which are working also in abroad. So, the goals of PNRSI is to provide a forum for dissemination and critique of nursing research, stimulating interest in the scientific study of nursing phenomena, linking nurses with similar research interests. Okay, so usually they do hold a convention every November of the year for these researchers to share their research findings. By the way, PNRSI does not only involve graduates or BSN, but also graduate students, those who are taking master's and doctoral degree, and of course, nursing students. They do have different small groups or what they call as cells in different nursing higher education institution. Fourth goal of PNRSI is promoting recognition of nursing as a scientific discipline, promoting evidence-based nursing practice, and of course, fostering ethical standards in nursing research. With the goals of the PNRSI, the following purposes emerged. First, promoting recognition of nursing as a scientific discipline. Remember that the more we do nursing research, the more we validate and prove nursing to be a science. Secondly, linking nurses with similar interests on nursing and nursing related thrusts, not only in the academe but also in the healthcare setting, providing a forum for dissemination and critiquing of nursing research, publication, continuing education, and training. And of course, fostering ethical standards in research in nursing with particular focus in the academe and healthcare setting. So we have learned that there could be a possible interest group for you, nurses, when you go in the clinical settings, both academe and including the public health. When you are so much enthusiastic to do nursing research, there would be a group that you can be joining with or belonging to. Thank you.